January has been very cloudy overall. We only had 3 days so far with bright sunshine and blue skies.
It's cold out. The days are shorter and you are more tired than usual. If you are feeling extra sleepy and fatigued during the winter months, you're not alone.
Many people find themselves with low energy during the winter months. Can you explain to me a little bit why that is?
A lot of it has to do with during the winter months in this hemisphere, obviously, there are shorter days, so people get less sunlight exposure. So that can impact things like vitamin D, also can be disruptive of circadian rhythms, which can throw off our sleep. With the cold weather, people have a tendency to be outdoors less, so they're getting even less light. And in addition to that, they tend to be less physically active. And we know that physical activity oftentimes is something that boosts our mood and energy levels. And clinically, when I work with clients, I have a weight loss specialty. And what we see a lot of times is during the winter months, there's a lot of holiday parties and celebrations and things like that. And through the holidays, people have a tendency to overeat. And there tends to be this cycle where we overeat, we gain some weight, we then beat up on ourselves for gaining the weight, we feel worse, and then we overeat to compensate. And that cycle leads to more weight gain and sometimes lower moods.
It is important to keep track of your symptoms because they can actually be tied to another diagnosis, seasonal affective disorder.
If the changes in mood are really tied to the seasons, and that can occur at least 2 years in a row, that's going to typically be diagnosed as a major depressive disorder with seasonal affective disorder as a specifier. So it's often called SAD as the acronym. So it's really, we're looking at mood symptoms that are depressive in nature that are coming at that specific time of the year or some pattern on an ongoing basis.
Here are a few things you can do to deal with low energy.
One, you want to increase your sunlight exposure. So the easiest way to do that, of course, is just to make sure you're getting outside. You could even get a light therapy box. In addition, making sure that you're maintaining or increasing your exercise or physical activity. And that can be challenging, but the cold temperature doesn't have to be a reason not to exercise outside. In addition, I have clients schedule pleasurable activities. So those things that bring us joy, excitement, hope, we're going to find ourselves smiling or laughing. Could be doing something fun with a friend, could be playing a pickup soccer game on the weekends. Something that brings you pleasure, we know that bolsters people's mood. You can also schedule what we call mastery activities. So that is learning a new skill, gaining some new knowledge, or refining and practicing and getting even better at something you already do well. In addition, decreasing social media and screen time and looking for real social connection that's in person, or even reconnecting with people who are far away, but having real longer term conversations by phone or FaceTime or something like that. The other thing that's really tied to mood is sleep. We want to practice good sleep hygiene. One of the most basic things is just to make sure you're going to bed and you're waking up at a regular time every day. But I think those are sort of simple things if we're talking about something that's just winter fatigue. Likewise, if it was clinical in nature, those are some things that most likely a clinician is going to recommend you do as well.
And remember, talk to your doctor if you're experiencing any mood changes or other symptoms that are out of the ordinary. Reporting for NBC New York, this is Jennifer Vazquez.